Dr. Nachar, Dr. Premanand Kumar, Shri Devdas, Dr. Ravindran, eminent citizens of the city of Madurai and Tamil Nadu, members of the gene pool of Venkataswamy, members of the Arvind Eye Care System family, eminent guests from all parts of the world, ladies and gentlemen. At the very outset, I'd like to apologize for the lack of felicity with the languages, so I will not be able to speak in Tamil. I'm one of the very few probably sitting in this room among ophthalmology and eye care community that is privileged to have a long association with Dr. Venkataswamy. In fact, my father and Dr. Venkataswamy were colleagues at the Madras Egmore Eye Hospital in the old days, and we were neighbors in the assistant surgeon's quarters. And Dr. Nachar made sure that I could play very well with her. This was a long time ago, in the early 50s or so. I don't want to reveal my age or her age at that time, so that I don't have to give you a chance to calculate our ages. A popular saying is, those who bloom late, bloom full. What a full bloom it was. That, as you have seen from the report of Dr. Ravindran, that is touching over 5 million people each year, transforming their lives. What is it that made Dr. Venkataswamy what he was? Several qualities. When we talk of physicians and medical care, the most important aspect of a physician is caring. He had that in plenty. He had incredible self-discipline that catapulted him to where he reached. Ever working and yet very humble. And he valued effort more than anything else, not the outcomes. He was a great physician in the true sense of the word, a teacher who inspired generations of eye care professionals in India and outside, the man who planted the seeds of research in ophthalmology in the country, and a real entrepreneur, as you could see the way the Aravind tree has grown. Overall, he was indeed a visionary leader. A visionary leader who did only transformational things, not incremental. He did not believe in incremental things. When he was still in the government, he realized the importance of 2 areas of blindness that were causing major damage in southern part of India: cataract and vitamin A deficiency. In those days, cataract, vitamin A deficiency in the south, and cataract and trachoma in the north were the major causes of blindness. And he began to deal with this problem very effectively. And when he moved to Madurai, to the surprise of many in the country, out of a government system where everybody thought it was impossible to do anything big, he created one of the biggest eye centers in the country and in the world, which was a composite of high-quality clinical services with multiple subspecialties, even in those days, educational programs for many cadres of eye care professionals, and brought in the culture of research in that center, started community eye health programs in a big way, and of course, he was very well known for his advocacy, both at the national and global levels, that has benefited millions of people throughout India, and in the policy formulation and planning related to eye care. This governmental model has influenced many other governmental systems, and many other leaders around the country followed and created several such programs within the governmental system, and several organizations then followed. In cataract surgery, he found solutions to touch large volumes of people, efficient and cost efficient. He, along with the Arvind family, created systems that are now universally acclaimed. And of course, began to focus on the outcomes of such interventions so that every intervention results in a positive outcome. Kerata Malaysia was one of his other targets. So much so, his and others that followed him around the country worked relentlessly to eliminate this problem, and today, Kerata Malaysia is no longer a major cause of blindness in India. Arvind Eye Care System that you see today is an amazing creation of a legendary leader. And Spanish poet Macheda said, "Wanderer, there is no road. The road is made by walking." When Dr. Venkataswamy came to Madurai, there was no road to eye care to Madurai. He created the road, and the entire world walked on that road to Madurai to learn what eye care is all about. His vision grew and multiplied, and that vision was to banish needless blindness. And that he accomplished in ample measure. And he also left a large challenge for the future generations of Arvind Eye Care System and everybody around the country and the world to eliminate all needless blindness throughout the world. He created models for high quality, high volume services, high quality education to create the necessary human resources to provide that care, research, now proliferating out of the Arvind Eye Care System, public health, and through the RO Lab, an incredible system of product development, and of course, helped scores of organizations around the world in capacity building and advocacy, planning, and policy, both at the national and global levels. And in fact, Arvind is one of the major global resource centers in the world in the area of prevention of blindness and eye care. So Dr. Venkataswamy and the Arvind Eye Care System have become a global phenomenon, inspiring generations of people. The impact, direct through the Arvind Eye Care System within Tamil Nadu and elsewhere to millions, and indirect through their capacity building programs and education efforts through their alumni to billions of people around the world, and benefited generations of healthcare professionals. Mahatma Gandhi said, "Strength does not come from physical capacity. It comes from an indomitable will." There are few other better examples than the life of Dr. Venkataswamy that so well manifested this saying. Ladies and gentlemen, thank you so much for giving me this privilege.
Arvind Eye Care thanks Dr. G.N. Rao for elegantly spelling out Dr. Venkataswamy's legacy to Indian and global efforts to combat blindness.